Well, it's Wednesday, and that means it's West Tech's Wednesday, and we have Dr. Beck here with us live in studio. Thank you again for being here.
Thank you. Good morning.
And today we're talking about strokes,
Yes.
something that a lot of people can experience. Or how do you know if you're having a stroke or you're not?
And it's not always easy to tell, but the warning signs or symptoms that people should really watch for include numbness to a skin area, weakness, slurred speech, dizziness. The symptoms can be varied depending on what part of the brain is being affected by the stroke.
And what specifically is a stroke?
That's
to break
a good question. Good question that I wanted to bring up. There's two main types of stroke. The one that we see most often is where a blood clot forms in an artery in the brain, and so it blocks the blood supply to that part of the brain. Now, unless something is done very quickly, that could be irreversible. That area of the brain that's being supplied by that artery that's blocked could forever be damaged. Now, the other type of stroke that we do see sometimes, not as often, the damage can be similar, but the event that sets it off is different. That's where there is a rupture of a blood vessel in the brain, what we call a hemorrhage or a bleeding in the brain, and that can be traumatic, but most often it can be due to either hardening of the arteries, atherosclerosis, or elevated blood pressure, someone who has high blood pressure and they don't get that taken care of.
Now, is this hereditary as well as something that could happen after a surgery, or kind of how do strokes come about?
Yeah, well, there's multiple risk factors for strokes, and if you think about the pathology or the pathogenesis of a stroke, it's like a heart attack. We can relate that. A lot of people understand that heart attacks are caused by blocked artery in the heart itself. It's the same type of scenario in the brain, but it's a blood clot in the brain. So the things that increase the risk of blood clots in the brain include forming atherosclerosis. So we look at the risk factors include somebody who's got high cholesterol, somebody who's got high blood pressure, and diabetes. Those are all risk factors for strokes or heart attacks. And what happens is you can get buildup of plaques or atherosclerosis in an artery in the brain, and those can break off, form a clot, and then that basically causes a stroke. So the things that we look for as far as risk factors are, again, controlling blood pressure, looking at the blood lipids or cholesterol, and if someone is diabetic, they're more likely to form atherosclerosis if they're diabetic. So we want to make sure we control the diabetes.
Is age a factor as well?
Yes.
Or?
Yeah, age is definitely a factor. Strokes can occur in young people. When we talk again, I mentioned there was two types of stroke. If someone has an aneurysm can occur in a very young person. And if what an aneurysm is, it's a weakening of the wall of an artery, and that can rupture if it's not diagnosed or treated. But most often it's an age-related phenomenon, just like most heart attacks as well. The older someone is, the higher their risks are for having a stroke.
So if you're feeling the symptoms of numbness or slurred speech, what should you do?
Yeah, well, you should get help right away. You should call 911 or get to a hospital emergency room as soon as possible. And we have ways to try to figure out if someone is having a stroke. And there are treatments available, but the big deal with treatment for stroke is time. Time is brain, and there are medications that can be used to help dissolve that clot, but you have to get that medication done very quickly after the onset of the stroke symptoms.
Well, very informative, Dr. Beck. Thank you so much for being here. And we have your information as well. Any updates, anything that you need, Dr. Beck is here. So thank you so much for being here. And here is his website right here, westtechurgentcare.com. But stay with us. We'll have a final look at our 7-day recap and also of your top stories. Dr. Beck, thanks again.
Thank you.